Hi, I'm Dr. Hubbard. I publish the website, thesurvivaldoctor.com. This is my partner today, Leanne, my daughter. She's behind the skeleton if you get the areas mixed up. And she'll come out here and I'm going to talk about the shoulder today. Usually it's somebody that is something like bringing their hand back like this, falling and catch onto a limb or something, or sometimes they just have a fall. She's going to come in holding her arm like that and not wanting anybody to move it. The other thing is you can usually see an indentation here. Compare it to the other shoulder, see if it's different. If she'll let you, if it's not too painful, feel there. It may be mushy. Compare it to the other shoulder. If it's because the shoulder joint has dislocated and there's the ball is no longer in the socket. There's three ways I'm going to show you today. There's other ways, but these are pretty simple. The first way is very simple, but you have to have something where you can hang your arm completely off the ground and let it dangle. Okay, Leanne, if you could get on your stomach. Now the person's going to be in a lot of pain and you're not going to be able to move the arm very much, and you're going to have to help them and encourage them. And then get them the shoulder all the way off to the side where everything is hanging of its own weight. Now, it's good, the better the person can relax, the better this is going to help. Because what's happened to the dislocated shoulder is the ball of the ball and socket is behind the socket. The muscles have tightened up so it can't get back in. The ways to try to get this back in is try to stretch the muscles gradually, never jerking, just gradually, and when it gets to a certain point, it'll just pop back in because that's where it wants to go, that's where all the muscles want to go, and then you have the shoulder back in place. Now in this particular setting, pain medication, muscle relaxers if you can have them, and then you put about a 10 to 20 pound weight on the person's arm down here. You can use an ace bandage and just wrap it around there. You can use some duct tape, which is probably better. Something that'll hold it good and steady enough where that it's not going to fall off. If there's nothing like that, then you can have the person hold on to the weight, but that's going to make a little tension in their muscles. We want them to relax as much as possible. Now if this is going to work, it'll work within about 10 to 20 minutes. After that, you might as well try something else. The second way is also easy. It's better to have a second person to help, in other words, 3 people all together. But Leanne, if you could turn on your back. Now since we just have this one side, I'm going to play like this time. It's this shoulder that she's hurt. Okay, what you're going to have it would be good if you could have someone wrap something around her waist and pull against you. You're going to, you can just stay right there. Okay, you're going to straighten out the elbow, and then never jerking, you're just going to start easing and easing. And it may take a few minutes. You're going to talk to the person, try to get them to relax and and pull and pull and pull, and until they will usually say it's back in place, because they'll feel a pop and a lot of relief of the pain. If you don't have another person to help you, you can use say you're on the ground with this, you can use your foot, but some way you're going to have to do something counter tension in order to make enough stretching to get it to go back into place. A third way, this is one you really have to be careful with because there is some torsion in the bone, and you can break the bone if you don't be gentle and just take your time. The person is going to probably be something like this. You're going to start talking to the person, and you're going to bring out their arm with their hand like this, and just really, really slowly, and if they start jerking or giving pain, stop for a second. If they start saying it's painful, then stop for a second, then start back. You can bring it out like this. Then you're slow, and you're going to get it at about a 90-degree angle. You're going to keep the palm up. You're going to keep the arm, the shoulder, at the parallel with the body. And then you're going to bring very gradually the shoulder up like this. And you're going to keep going. And there shouldn't be any resistance against it. If there is, don't do it. But you should gradually be able to bring it up. It should be easy to do. And at some point, when they get about here, it's usually popped back into place. Now, this is the one method that you could do also if you were out on your own and had a dislocated shoulder and no one was there to help you. Leanne, sit up, please. Okay, so you're out on your own and you're like that. Okay, what do? Well, bring your arm out. Do that, Leanne. Bring it out just come on out like that. Slowly, as best you can. And just bring it up on your own. Bring it like you're touching your head. Okay? And there it is. Okay, you know the shoulder joint is back into place if the person can touch their other shoulder. If they can't touch their other shoulder, then it may not be back into place. If you can't get it back into place, the best thing to do is put it in a sling, put ice on it, and see the doctor as soon as possible. And of course, always it's best to do that anyway. And that's the end of our video. You can see how to diagnose and assess shoulder injuries at www.thesurvivaldoctor.com.